In this video, we will talk about the process of COVID-19 vaccination. Every vaccination site will follow the same process for providing vaccination. The vaccination team should arrive well in advance of the time of starting the session. This will give them an opportunity to check the availability of all logistics. Please make sure no team member comes to work if they are sick, and should all wear a mask at all times when at work. There will be 3 rooms or identified and demarcated areas and 1 entry point to the site. The beneficiaries wearing face masks or face covers will be requested to identify themselves at the entry whilst entering. Once inside, they will wait in the waiting room. As per the schedule, they will get vaccinated. Before they receive the vaccine, their Aadhaar cards or other government-approved ID cards will be verified or authenticated. They will then wait for 30 minutes in the observation area, following which they will be allowed to exit the vaccination site. Come, now let us explore the roles and responsibilities of different personnel working at the vaccination site. 1 guard will be positioned at the entrance of the session site. He or she will be provided a list of beneficiaries registered for that day at the given vaccination site. The guard will ensure that pre-registered beneficiaries enter the site after washing or sanitizing their hands. The unregistered beneficiaries will be referred to the mobilizer for further guidance and counseling. In areas where cultural sensitivities like use of hijab by women are expected, separate enclosures may be prepared for identification of female beneficiaries, and a female volunteer should be deployed for the same. As stated, beneficiaries will be allowed only during the same day as informed to them through a text message on the registered mobile number to avoid crowding. After entry to the vaccination site, beneficiaries will wait for their turn for verification. The seating arrangement in the waiting room and otherwise will be done with physical distancing of 6 feet. In the vaccination room, there will be a verifier present who will verify the identity of the beneficiary based on Aadhaar number or card or other alternate photo IDs as per the guidelines. The vaccinator will also be provided a printed list of beneficiaries. They will administer the vaccine to the authenticated beneficiary and make an entry in CoWIN application and ask them to wait for 30 minutes in a pre-allocated space while following COVID-appropriate behaviors. In case of healthcare workers, if Aadhaar is not available, the verifier will ask for service ID or institution's letter or employment proof for identification. If they do not have any ID, service ID or employment proof, they will not be vaccinated and will be further referred to support staff for guidance. The vaccinators should take care of the following points to ensure safe injection. Male vaccinators, while vaccinating female beneficiaries, should have a female attendant or support staff present in the vaccination room. Wash hands with soap before and after the vaccination session. Cover any cuts on their skin. Avoid giving injections at the injection site where there is local skin lesion, cut or dermatitis. Always use AD syringes during the COVID-19 vaccination campaign. These syringes prevent person-to-person transmission of blood-borne pathogens. Use a new sterile packed AD syringe for each injection for each beneficiary. Do not use AD syringes that have damaged packaging or have passed the manufacturer expiry date. Do not pre-fill syringes. Sanitize your hands before vaccinating each beneficiary. Vaccinate the beneficiary with the recommended dose of COVID-19 vaccine through appropriate route of administration. Do not attempt to recap the needle. This practice can lead to needle stick injuries. Immediately after injecting the beneficiary, the AD syringe must be cut from the hub using the hub cutter and cut part of the syringe put in the red bag. Do not put the syringes on the table or on a tray after the injection. After the vaccination, the vaccinator should inform the beneficiary about these 4 key messages. which COVID-19 vaccine has been administered to them. Contact the nearest ANM or ASHA or medical officer for any adverse events. They shall be informed the date of the second dose of the COVID-19 vaccine by SMS. They should continue to follow COVID-appropriate behavior even after vaccination. The vaccinators will also ensure safe storage of injection waste at the site by following these steps. Cut the hub off the AD syringe immediately after administering the injection using the hub cutter. Cotton contaminated with blood or body fluids will go in yellow bag. Store broken vials in the blue puncture-proof container. Segregate and store the plastic portion of the cut syringes in the red bag. All other non-infectious wastes will go into bag for collecting municipal waste. The immunization waste will be collected by designated person for safe disposal at the end of the day. Once the vaccination is done, the beneficiary will wait in the observation room for 30 minutes. One support staff will be positioned here to oversee the vaccinated persons. They will look for any adverse events and immediately inform the vaccinator for AEFI management. Only by following all these important steps and guidelines we can make sure that these vaccination session sites run smoothly and protect both the vaccinators and beneficiaries from the risk of COVID-19 infection.